Good day. On behalf of Patient Choice, I'm Dr. Dangleben, and this is a short educational piece on Diclofenac. Diclofenac, on my last visit to Dominica, a lot of patients came to me asking about Diclofenac, and there's a misunderstanding about that medication, and there's a lot of usage of that medication without the fundamental knowledge of understanding what it is. It's considered a non-steroidal anti-inflammatory drug, NSAID, okay? Ibuprofen, naproxen, indomethacin, and diclofenac, and a few others fall under that category. But what I want to talk about is really ibuprofen and diclofenac. They're both non-steroidal anti-inflammatory drugs, right? They're used for pain, reduce inflammation, and also to lower fever. The key difference is really in their strength and their side effects, right? And let me just tell you, ibuprofen is Motrin and Advil. So both Motrin and Advil, they're both ibuprofens, okay? Diclofenac is Voltaren. They're over the counter, right? And they're used for, ibuprofen tends to be used for, as I mentioned before, you could use it for headaches, menstrual cramp, minor injuries, and general aches, right? It tends to be a little gentler on the stomach than diclofenac, but they both can form ulcers. All the NSAIDs, except, Celebrex. That's a totally different conversation in and of itself. So diclofenac, that's being used predominantly in Dominica, is more potent, right? So, you might have gout, you might have postoperative pain, you might have arthritis, and the doctor gives you that and say, go and get some diclofenac, and you're taking it and not understanding the gastrointestinal side effects and also the potential cardiovascular complications and kidney issues, okay? So all NSAIDs have that risk, but in terms of ibuprofen versus diclofenac, and the reason why I'm bringing this up because folks come to Patient Choice and ask that question. I said we have ibuprofen, and they're like, well, we want diclofenac, and I had to sit and explain to them. They all have their side effects. Let's just get that straight. But in terms of ibuprofen versus diclofenac, it has a safer profile, right? It's less potent than diclofenac. So, yes, diclofenac is stronger in both its pain control and anti-inflammatory response, but it has more potential for severe side effects, right? I mentioned the cardiovascular risk. There's actually a warning. Okay, you have increased risk of cardiovascular events when using that medication. All right, so that's just something that you have to know. I don't want people just taking medications just for taking sake, right? Increased risk of bleeding from ulcers and perforations. That's also on there, right? Now, if you have kidney problems, if you have underlying kidney problems, diclofenac can worsen that, especially if you have existing kidney issues, if you have heart failure, or if you're taking certain blood pressure medication or water pill, okay? Also, it should be avoided in the late pregnancy, right? Because it can affect the fetus, all right? So these are the kind of things that you need to know when taking these medications. A lot of people are on diclofenac with liver disease, with kidney disease, drinking a lot of alcohol, and not understanding the potential side effects, okay? So I just want to put that out there. If you come to Patient Choice, you have the options of ibuprofen, which is Advil and Motrin. You have naproxen, which is Aleve, okay? These are all non-steroidal anti-inflammatory drugs. They all have side effects, and one of the things I will continue to do is educate people on these medications, okay? Everything has the side effects. You just have to know what you're taking, how you're taking it, when you're taking it, etc. This is Dr. Dangleben on behalf of Patient Choice. Have a great day.